that's amazing. Kudos to the scientists. But I wouldn't make our plans based on it. It's not smart. It's like saying you're going to buy one stock and in 10 years you're going to be a billionaire. It's not a good move for your money. So we really got to, spend our efforts where we can spend them in all these other efforts while we're hoping for a vaccine. And here's the other thing to remember, folks. Once we get a vaccine, everybody has to then get the shot, right? And once they make a vaccine, they estimate it's going to take at least a year to get everybody in this country vaccinated, and probably 2 years to get everybody vaccinated. Because as you said, first you have to get it to everybody. Second, you're going to have to convince a lot of people. Now, as far as convincing people goes, is this. I understand all the fears people have about vaccines because there's been a lot of misinformation about that, just as much as there has been about COVID. A lot of folks are against vaccines in general for the kids, and, they say there's information. Again, this is something that I know a lot about because in my other job as a chief medical officer, I'm basically an epidemiologist. We look at these things on, large populations. We have a population of about 1.6 million people in our practices that we, look at these big groups of information for. And I've looked at the vaccines. There is really no credible evidence that the vaccines cause some of the problems that people are worried that they cause. And so this particular vaccine is not going to have any of those problems either. But look, people are fearful of it. Hopefully people will understand, or maybe people will be afraid enough for their business that they'll grin and bear it and get the vaccine anyway. But I will tell you, the vaccines are very safe. The literature is there. I'm very comfortable and confident. I'm somebody who puts my money where my mouth is. My kids all get vaccinated. I love my kids dearly. I like every one of you, I wouldn't get near a vaccine, a mile away from a vaccine, if I thought there was the tiniest hint that my kids were going to get sick from a vaccine. We're going to get this vaccine as soon as it comes out.
Good to know. The random testing, the question is, you suggested random testing, but isn't that a HIPAA violation? If it's a gray area, what do you suggest to keep or minimize that gray area?
Hang on a second. Can that person type in what they mean by HIPAA violation? HIPAA is whether or not some people knows your private information. Getting a test, nobody's gonna know your private information, except maybe the government where it's reportable, but lots of things are reportable. If somebody gets Lyme disease, it's reportable. If somebody gets tuberculosis, it's reportable to the government. They don't share it with anybody else, and it's not a HIPAA violation. So I'm not sure what you mean about random testing. Random testing is absolutely not a violation. But think about this for a second. When you get married, you got to get some blood tests. Those blood tests are to look for syphilis and to look for a bunch of other diseases. We already do surveillance testing all the time for lots of things, constantly. So no, it's not a violation of anything that I'm aware of, but maybe I'm not really sure what you're understanding. So if there's some other explanation.
Follow up with that.
Yeah.
Are you aware of any treatments that are showing promise?
Well, like the remdesivir, it's that one of that, it's called a biologic medicine. It basically mimics, some other things in your system that are chemicals that help fight any vaccine or any virus. But when you say promise, remember this, it's nowhere near, like, for example, the flu has something called Tamiflu, right? If you get Tamiflu in the first 48 hours, it just knocks the flu out, gone, bye-bye, done, right? Most times, not always, but most, right? So it's Tamiflu, very effective. Remdesivir, you're saying, gets a person healthier 2 days earlier. There's a big difference between knocking it out and getting you better 2 days earlier. No, we just don't have really effective therapies yet. We all keeping our fingers crossed. We all want to be hopeful. But again, you can't pin your hopes on what is just a minor bet. These are minor bets so far.
This question is, are you able to differentiate between asthma and allergies and COVID? Like, could some people have a mild case that they didn't know, and maybe steroids aren't working for their current situation? So
yeah, sure. Well, so they hope to use symptoms, but the reality is you can't use symptoms because, like we said, there's such a huge number of people that don't have typical symptoms. Now, there's a good testing regimen proposed by an epidemiologist up at University of Michigan, which I like, and I'm hoping that we can start instituting that in our office soon and getting it further out. But the reality is, you know, if I'm doing something individually in my office and it's not a national strategy, you know, coming from our CDC, how effective can it be? We need a national strategy from our CDC. But what this promising thing is that there is a protein that'll show up in the blood of somebody that gets a virus, any virus, within 24 hours, whether it's COVID or the common cold. And this thing is called myxovirus reactive protein A, or MYXA, they call it. And so they came up with this testing strategy where they said, well, you can look at something that's called C-reactive protein. That comes up in any inflammation, whether it's bacterial or viral. And then you can do a test for that and the myxovirus protein A protein simultaneously with a finger stick with what's called a lateral flow test. Basically, everybody's familiar with the pregnancy test, you know, where you put a little sample on the little thing and it just kind of moves up the paper and it gets the paper and either the line turns blue or the line doesn't turn blue. And either have it or you don't. They can do that already for this. And it's a 5-minute finger stick blood test that they could get out to all the doctor's offices. It's got 96% sensitivity. So what would be great about that is this. If they did that test in your office, right, and it's negative, you don't have a virus. And if it's positive just for that C-reactive protein, you have a bacterial infection and not a virus. And if it's positive to both, you have a virus, then they got to test you maybe for coronavirus. But if it's negative, you have your allergies or you have your asthma. See, so these are ways that you can smartly rule things out with a testing strategy. But, you know, unless it's made in bulk for 360 million people in bulk by our government and sent out, it's not going to happen. And this is why we got to be, please, I implore all of you, call all of your representatives tomorrow and every day after that and tell them, what did you do today to increase testing for us? Please.
That's on everyone's to-do list for tomorrow.
Yeah.
So there's a question about the reliability of the test for both the active virus and the antibody. I mean, they said they've heard several cases where people had it several times, it was negative, and then found out they had the antibodies. And I know we keep hearing about that.
Right. So we'll talk about both tests. Okay, so first for the antibody test, it's got a 98% sensitivity and specificity. What that means is these are two parameters you look at a test to see if it works. Sensitivity means if you have it, is it going to find it? Specificity is if it says you have something, is it the thing you're thinking or is it something else like a cousin? So, and you want to have as high as you can for both. So the antibody test is, if you get the typical antibody test that most of the labs are doing now, all the junk ones are pretty much gone now, then they have a 98% sensitivity and specificity. So yeah, it's possible it misses it, but pretty much it's going to catch it. That's not where we run into problems, really. Where we run into problems is with the PCR test, where you're looking for the viral particles in the back of your throat. And that one, if you get a good sample, is 99.9% sensitive and specific. So it's very accurate. The problem is the sample, right? So you got two problems. Roddy, I know I can't see everybody, but just to yourself, raise your hand if you've had one of the COVID virus tests, okay? I've had several, right? If you get it the right way, it's a Q-tip, a little smaller than a Q-tip, but it's a Q-tip that they stick way in the back of your nose. And, you know, for a guy like me who's been training residents how to do nose cameras my whole life, I'm used to having stuff stuck in the back of my nose by a bunch of guys that don't know how to work the camera. But for most folks out there, it can be a little jarring, and I get it. So, you know, it's hard sometimes to get the Q-tip to the way back. And if you don't get it to the way back and get a good sample, you know, they say all comers right now, these tests have anywhere from, you know, a 75% accuracy all the way up to 100. It really depends on who's working the Q-tip and whether or not you're getting a good sample. And that's part of the problem. And some of the new tests are saying that, oh, well, you can just get it from rubbing it in the front of your nose and in the back of your throat. And I've seen the statistics that say they have a 96% sensitivity with that. See, the reason why you got to get to the back of your throat is that the receptors for the virus are in the back of your throat. They are not in your mouth, and they are not in the front of your nose. So the virus is going to hang out in what's called the adenoid tissue. Everybody's probably heard of tonsils and adenoids. The adenoids are in the back of your nose. And you got to get back to the adenoids. That's where the viral receptors are. That's where most of the virus is going to be. And if you're only using the secretions in the front of your nose, what are the odds it's going to be there? If you believe some of the test literature, you know, they're saying as much as 96%. I'm a little pessimistic on that one. To me, the jury's out. I haven't seen enough data, and I'm not convinced yet that a nasal swab alone is going to get it. So if you all go for a test, find one where they go all the way in the back with a Q-tip. It's a little jarring. You get used to it. It's not that bad.
Go for the uncomfortable one. So that might play in. I have a number of questions. I know we're getting towards the end. I'm not sure how long you can stay on here, but
That's right. I got time. I'd rather answer the questions. This is
okay.
important.
So this might be a follow-up to what you just said. Somebody mentioned that they've heard that daily nose rinsing, such as with a neti-pot, can cut down on the amount of viruses in your sinuses.
Right.
How do you feel about that?
Yeah. So I actually think it's a great idea. There's a study that's ongoing now about that already, a randomized placebo-controlled trial, and we don't have the answer yet. And I love the idea. It was one of the first things that ear, nose, and throat doctors came up with, because you have to remember, folks, our patients have the stuff in the most infected part, in the back of their nose. And a lot of folks don't realize, ENT doctors, they think we do tonsils and tubes and that's it. It turns out we actually do a lot of more urgent, very complicated surgery on patients when they can't breathe. So when an anesthesiologist is having a hard time getting a breathing tube in and somebody's dying, they call us. We're the ones that go in and get the breathing tube in, whether we use a camera to snake it through the nose or the mouth, or we quick cut a tracheostomy, a hole in their neck. Well, other than the nasopharynx, the back of the nose, the trachea is where the rest of the virus is. So it turns out we're the most exposed to these dangerous viral particles. So we were dreaming up from the beginning, any way we could think of to cut down on the risk of exposure. And there's a lot of literature to show that if you get these things with soap, if you get the viral particles with soap, or if you get it with betadine, which turns out is fine to put in your nose, then you rinse your nose with that stuff. That's going to even kill, if you think you've been exposed to some of the particles, that could potentially kill it before you get a real significant infection. And so there's some studies to do it. I know a lot of ENT doctors that every time they end up in the intensive care unit and they just had to do a procedure for extra safety, they'll go home and rinse their nose, and they'll put some baby shampoo in a nose rinse bottle and rinse their nose. I think it's fine to do. I will tell you that we have our patients rinse their nose with a mix of saline and baby shampoo all the time for chronic sinus infections. So we know it's safe. And so I'm happy to tell everybody, go ahead and do it. What I'll tell you to do is you get those neti-pot bottles, use the salt packets, use the water. What's very important for everybody to know is you have to get distilled water only. It cannot be anything other than distilled, because every other water comes out of the ground. There's some amoebas in those distilled water. That's not distilled water. Amoebas in your stomach don't cause a problem, but in your nose, the little buggers can attach to nerves. They've crawled in the brains and they've killed people. So it's very, very important that you guys make sure you get it, use the stuff that's distilled water. And then all you have to do is get Johnson's baby shampoo and just add 4 drops to the 8-ounce bottle. Neti-pot's typically 8-ounce bottle. And just 4 or 5 drops of it to get some soap in there is usually enough. If you put too much soap, you blow bubbles out your nose all day. It's kind of a funny party trick, but you won't hurt yourself. So just go for 4 or 5 drops of the baby shampoo and shake it up.
All right, that's great advice. I hadn't heard about that before.
Yeah.
That one's new. What suggestions do you have for young children who can't wear a mask or don't wear a mask? Let's say they're under the age of 2. Is there concern for them going to daycare or going out in public?
Yes. I would just, if they can't social distance, and I would distance at least 9 feet. It's important for kids to get out. They need to go out. They need to get outside. I honestly don't know how we're going to work school for those kids. I think they probably need to stay home. I think it is completely unworkable for those kids. I think they need to be social. They need to be in school. They need an education, and their parents need to go to work. So I realize that telling them they probably need to stay home is just an impossible thing to say, but it's also impossible to say we're going to keep them from getting sick or infecting others. So, what's the only choice left?
Right. It's tough decisions. I know it's a big problem with the business owners that are, as they're looking at their workforce in the fall and whether or not those students are going to be working from home or not, how they're going to manage all of that.
Yeah.
How often should you change masks and wash masks? And is washing it okay just in normal laundry detergent?
Yes. Any soap kills the virus. I mean, these virus particles, they're horrible when they get into your cells, but when they're outside the body, they're very delicate and they're easy to kill. So any soap kills it. Give it 20 seconds of soap. So if you put it in the laundry, it's dead. Okay. The other thing is just air. I mean, if it just hangs in the air and dries out. So what they'll say is if you have a couple masks, you want to rotate the masks. You wear a mask for a day, and then you can just hang it up, somewhere in your house on a hook, and let it sit for 3 days and make sure it dries out. And if it dries out, anything on it's dead. But even better if you throw it in the wash.
And how about sunlight? I was putting mine out in the sun.
Not really getting enough UV light there. Nah,
Okay.
it's not getting enough UV light. The sun doesn't do to it what they think it does. Now, floating around in the air, yeah, maybe a little bit of natural light's getting it. It's really more, it's just getting carried away in the wind is all, and getting diluted in the wind.
Okay, I'll stick to the soap then. How safe is it to go to an in-person doctor visit versus going to, say, the grocery store or Target?
Yeah, assuming your doctor's office is doing everything they're supposed to do, it's much more safe than going to the supermarket. Not the supermarkets are bad, you got to go, but the doctor's office are very safe. And again, if you want to see our website, you'll see what our protocols are. We have videos to show you and tell you everything that we do. Most doctor's offices are doing what we do, which is that they're screening you before you come in. Most of us are using your car as your waiting room, so there's not a group of people sitting together. You're sitting in your car. You get a text when you drive up to our office. You go through certain screening questions. If there's any screening questions, you can't come in. You have to go get a COVID test before you can come back to our office. You have to get temperature checks before you can walk in the door. We do a temperature check out in the hall or outside. And you get the temperature checks, and then you can come into the office too. So the office is extremely safe. And as I said, we're always looking for the latest, greatest tests. That's why we have our own lab now. That big doctor group I told you about, Tippin, we have our own lab. We just recently signed a contract, by the way, for Montgomery County. So our lab, the Tippin lab, is the official lab for all of Montgomery County. And if you go to any Montgomery County sites or for all their police and fire, we're going to be doing all their tests in our own lab. And we're at the moment talking to Chester County too. So hopefully we get that set up too. So it's very safe to be in most doctors' offices as long as you're doing precautions. Make sure they're taking temperature checks when you go. Make sure they're asking you screening questions. Now, if they're not doing any of it, I wouldn't go. If they're doing that, safe to go.
Okay. Thanks. And I did see your video that you put out for the doctor visit, which was very helpful, and what to expect when you go to visit your office. Here's one. Are you sending your children back to school?
Yeah. So my wife's on the school board at Phoenixville, and they're voting tonight. And I'm actually, after this, going to the meeting. So we're going to be having a discussion about it. What I'll tell you is that I am desperate to get my kids back to school. They are suffering. They are really suffering. And it's painful to watch. It really is. So I want them to go, but I think I may send them a day or two and literally go and see how it's going. It really depends. I think in the end, what's going to happen is that some kids are going to start to get sick and spread it. So I will tell you, I wish I could tell you I knew 100%. Right now, if you tell me which way I'm leaning, I am leaning 75% against. I am leaning 75% against. And I'm happy to have another discussion with everybody again in 2 weeks when I see, what our measures are. I mean, I have been consulting with the school. We have looked at the CDC, and we have talked about all of the measures that they can take as far as the HVAC system and for the distancing and the A days and the B days. But that's part of why I'm going to this meeting tonight. I want to see it for myself, and I want to know exactly what's going on. And if I have a lot of confidence, I'm going to give it a try because we are desperate. But if it doesn't work, and if it's the way I'm worried it's going to be, no, I'm not going to send them.
Thank you. I know that was a personal question. I appreciate the answer there. Can you boil bottled spring water instead of distilled?
Yes, you can. So make sure you boil it. Any water is good. Spring water, it's all coming out of the ground with amoebas. So you can make sure you boil it. Make sure it cools off first. I got to tell you that. It's like the Jerry Seinfeld answer. Make sure you cool it off before you squirt it in your nose. But yes. And
then there was a follow-up in Dr. Bronner's baby soap for nasal rinse.
I don't know that one. As long as it's soap. So plain old soap will get you. Okay. So baby shampoo, by the way, baby shampoo, guys, is good because it's just plain soap. There's nothing else in it.
Okay.
That's why baby shampoo is good. If you get any other just plain soap with nothing else in it, it's good.
Okay, great. Animals. What about animals? No, that was a joke. Should they wear masks? But really, can animals be at risk for this? Like your dogs and your cats? Do you have to be concerned about your animals catching the virus?
Yeah, it's a really good question. We don't know. We really don't know. We do think that the animals can get it. We do think animals can get it. You know, I mean, look, they think that, I mean, look, there's a lot of conspiracy theories, right? People are like, it was made in the lab in China, whatever. I mean, the official thing is, and we really feel comfortable that this particular one came from some bats. So it already did come from an animal.
Right.
And it's thought that some animals, what I've read, the little bit of literature that's out there right now, they think that dogs get it a little bit less than cats. That's what they think.
Okay.
Again, I mean, it's a specific answer. Somebody asked, so I'm going to tell you. That's what we know.
That's what you know so far.
But yeah, but exactly how much less, I don't know, and I wish I could tell you. I think that there's probably some risk. Now, the interesting thing about it is that, you know, when you think about this, how much does your dog go out and be social? I mean, your dog goes out, but is he hanging out at a pub? Is he going to school? You know, so the dogs are, you think about it, your pets are pretty much isolated. You know, now we have a cat, the cat goes out, but he's a loner, you know, he doesn't like other cats. So I'm not too worried he's going to get it because he's just not hanging out with other animals. So,
Right.
yeah.
Okay, so we have one last question that was written in here. So great job. Thanks for staying a few minutes later so we can get through these. There's some data available that there's two, that your blood type may have some impact on catching or successfully fighting the virus. Can you?
Yeah.
Yeah.
Yeah. So yeah, they think it is. And I have to apologize to you. I forget which is the blood type that I think catches it less. I think it's O. I think blood type O negative gets it less, but I could be wrong. But those proteins again have to do with the cell surface receptors that let the virus into your cell. So they think that there's a little less chance of you getting it depending on your blood type. It is O. Somebody's telling me here. Yes, I see that. Thank you. So I was right about that. Yeah, I haven't read that one in a while. But the problem is it's about degrees. So yeah, there's a little bit less chance, but there's not enough protection. So it's not like you could say, oh, if I have a no blood type, you know, it's like having antibodies, I'm safe to go out. It's just not enough. So it's a curiosity. Can they turn it into a treatment? Maybe, but we're nowhere near a treatment that works in that way yet. So
If somebody's taking aspirin every day, does
Yeah.
that minimize their effectiveness of the temperature checks?
Well, that's a good question. Yeah, it could. It very much could. But again, that's why I say, you know, absent randomized testing, if we listen, the program I'm trying to put together for the schools that I consult at is, and this is through our labs, and I'm trying to make this work, is if we can test our kids twice a week, every 72 hours ish, then we have as much confidence as we can have that we're going to catch sick people early before they spread it to a lot of other people, and we can isolate them quickly and then let all the other kids go back to school. If we can do that, I'll be thrilled. My kids are going to school in a second. Now, the reason is this. It takes about 72 hours once you're exposed to get the virus. And so, or sorry, not to get it, but to start spreading it so that you have enough of the virus that you're going to start spreading it to others. It takes about 72 hours. So if you think about it, if you test everybody in the school, teachers, students, everybody in the staff, every Monday morning and then every Thursday morning, right? You're pretty much going to catch everybody, right? But the thing is, you have to think of the logistics. What you're going to do is you're going to have all the kids go to their homeroom or their classroom for elementary kids, and you're going to keep them there so they're a little bit isolated. Then what you do is called pooled testing, which means that, because you got to test everybody fast as you can. If you test everybody individually, it's going to take forever. So, you know, because you have a couple thousand kids in the school. So if you test every room at a time, say an average of 23 kids in the room plus a teacher, say 24, you can put all their samples into one batch. And then the machines do about 96 batches at a time. So, you know, our school district, say, for example, in Phoenixville, we have about 130 rooms in the morning. So with 2 machines, we can get the whole district with a pooled test. And what that is if it's negative, everyone in that room is negative. Now, if it's positive, you don't know which one of those 24 people in the room is positive. You got to go back and test those 24 people in the room individually. But, you know, if you think about it, if you're testing all 130 rooms in the morning, you're going to get 1 positive, maybe. So all the rest of the kids and all the rest of the teachers can go move about in school. Now, it may take an hour and a half, 2 hours. So you may have to change the curriculum in the morning for 2 days where the kids come in, and whatever your curriculum is, everybody stays in one room for the first 2 hours. We get the answer, and then everybody can go out of the room. Unless that room is positive, then those guys got to stay in the room and retest them.
Yeah.
That's ideal. Now, a temperature check, you're right. If you're taking aspirin and it's low, it may be wrong. It may be false. And that's why, you know, the advanced stuff, the testing and the isolation, we need funding. That's it. If we had funding for our schools for these tests, I mean, you think about this, we figure it would cost a lot of money for every school district. It would probably cost, you know, a couple $100,000 a week to test a whole school district.
Yeah.
It's a lot of money. But hey, guys, what else are we going to put our money in? What else is it for? Think of how much money we gave out in the first round of money they gave to businesses. And what did it do? It just kicked the can down the road. It didn't change anything, right? But if you put money into testing, it changes something. And that's what we have to start doing with the money. We got to stop kicking the can down the road and just keep telling we're going to give you money to pay your employees. So maybe in 2 months, something's going to be different. It's not going to be different unless we make it different. And testing will make it different.
To the question about the temperature, what is considered a fever? Like at what point should people be concerned? Isn't everybody's body temperature a little bit different?
Yeah. No, you're right. And it's not an exact answer. I wish I had one for you. I wish we talk about it in the office every day. So, you know, in surgeries and in medicine in the hospital, we'll consider a fever anything over 100.5. Okay. Now, that's because, again, statistics, and so there's a little bit of arbitrariness built into that. I will tell you, in our office, we decided to go with testing on patient and not let anyone in the office who's over 100. In part because it's just an easier number for everybody to remember. Because, you know, 100.5, and then there's statistics where it sits. So I would tell you the best number to go with really is just 100. If you go anything over 100, you got a fever, you ought to get tested. If you're under 100, the statistics are you're probably okay.
How expensive are the group test machines?
Well, the test, I guess they're asking for. So or you're just talking about buying a machine. You have to also have a level 3 certified state lab, which is complex lab. It's hard to run it. So you have to have the technical wherewithal to run it. Now, again, our lab can do that. But to test, I guess I see this here, is this one says everyone for the school test we reference. So what happens is it's about $100 a test by the time you're done paying for all the reagents and everything else per person. Now, if you do a pooled test, it should theoretically cut the cost down to some degree. It's not going to be like, you know, if you do 24 people, it's $100 for 24 people in a pooled test, because the reagent's the same, but you're still going to have tubes, and you're going to have little swabs. So you're going to have all these things, and it's still going to cost a little bit more. So it's right now we're not 100% sure. That's why we're trying to work out the deals and make it cheaper. But I will tell you, it's probably going to end up costing about, you know, maybe $40 a person a test. That's a lot of money. A test. It's an awful lot of money. You know, and the question is, how do we get the funding for that?
Right.
So
Good question. There's a comment that they make masks. This is from Bruce Zanner. He's with Motivational Marketing. Sells promotional products, and they make masks that have clear centers so you can see each other better.
Yeah.
I know that's been an issue too with people that are reading lips and
right.
I was in response to the comment about teens hanging out together, desperate to see each other.
Mm-hmm. Good. There you go. Oh, that's in response to that question. I was taking it a different way. So there was a question right above that. What about teens hanging out together? Should they wear a mask?
Absolutely should wear a mask, but they absolutely should get together.
Even if they're social distancing, let's say they're outside, they're social distancing. Can you take the mask off?
No, it's a good question. If the kids are, I would suggest that what you do is you have the kids stay 10 feet apart. The difference between 6 feet and 10 feet outside is really minuscule. It's not a lot. I mean, as far as they're feeling social with each other, it's not a lot, but it is a lot for the virus. And if they're 10 foot apart outside, I don't think they need a mask. By the way, my kids, I encourage it strongly. I've made personal phone calls to all the parents of all my kids' friends' parents, and I have taken them through the discussions and the literature, and I've invited them over to our house so that they can see how it can be done safely. And a lot of our kids' parents have taken us up on the offer, and so now they are spending time together, which I think, thank goodness, is important for them. And so they've been doing it, and they've been doing it successfully. So yeah, I don't think they need masks if they're 10 foot.
So we have one, we're going to end on one final question. This is an important one.
Okay.
Do you think that we will have a football season this year?
No, absolutely not.
Mm.
Contact sports. In fact, there are about 5 studies that have shown spreading these viruses around football games. And they did these things at tournaments so that there were kind of, you know, multiple games happening in the same day. And they just traced all these kids, and you could trace it back through, like, you know, 100 kids got sick. You could trace it back to the one kid who was sick at the beginning of the day. And by the time they were done having these tournaments, 100 kids got sick. There's no way to have contact without spreading secretions all over each other. I mean, they're banging into each other hard. There's secretions flying out of their mouth, and it's getting all over each other. It's just not possible.
Yeah. That's a tough one.
Yeah.
Okay, so I think that wraps up the questions, unless you see any that I missed as we were going through. Oh, there was one about the neti-pot. Can you use tap water? Did you see that instead of if it's ultra filtered through osmosis system?
Right. No, the amoebas go right through all that. Now, if you want to boil the tap water, you boil it, it's okay. But but if you're not boiling it, no, it's not okay.
Okay. I believe we got to all of the questions for tonight, and I know you stayed late, and I really, really appreciate it.
Yes.
We will put the slideshows on our website.
Yes.
And hopefully this recorded, if I know at minimum it recorded the Q&A session.
Yeah.
So we'll post that up as well. That'll be on the chamber website by Monday at the latest.
Great.
And I want to thank you for the time and all of this information. This was amazing.
Great. Thank you. Yeah, I appreciate it. And I really appreciate everybody coming and asking the questions. Incredibly important. You know, spread this information around to everybody that you know. The fact that you're here means you're thinking about it. Make sure everybody else is thinking about it, please.
Yes,
yeah.
Absolutely. And stay safe and healthy, everyone. The chamber website, for those who aren't familiar with us, I'm going to put it in the chat here. It's pvchamber.net. So again, you can go to that site and we'll have the doctor's slide presentation posted on there, and then you will have all of his contact information as well to follow up for COVID testing or any of your ENT concerns.
Yes. Great.
All right. Thanks so much, Dr. Broker.
Thank you.
Have a good evening, everyone.
Thank
Bye-bye.
you. Bye-bye.